Today, we're joined by Kayla Cranenberg with the American Heart Association, and she's going to share how she and the American Heart Association have pivoted and pitched during this time. Kayla, welcome. Thank you for joining us. How are you doing today?
I'm doing well. How about you?
Good, good. So we're excited to hear what changes has the American Heart Association made during this time to adjust for the COVID era?
Yeah, so like everybody, our world kind of went upside down when COVID hit. We had an event coming up, our largest event, the Heart Walk, that was coming up March 14th. And on March 12th, we decided that because we are a health organization, we needed to pivot, as the name of this series is called, and take that virtually just for the safety of the 5,000 folks that usually come to that. So from March 12th, we've basically been working from home, and our organization as a whole has really taken this very seriously. We will continue our mission work that we've been doing around research and all of the preventative and education pieces, but we did start looking at how COVID could affect our survivors of heart disease and stroke and those individuals that had a higher risk. And so we knew that we had to play a critical part in being part of the solution. And so we started supplying a lot of resources for those high stress situations that employees and employers are going through, that kind of talked about mental resiliency. We started talking about exercise that you could do at home and recipes that you could quickly make for your family that were heart healthy. And then some of the stuff we started doing kind of on a large scale was a campaign called Don't Die of Doubt, where we were telling people that if you had risk factors or symptoms of heart disease or stroke, that you should still be calling 911, because we saw that heart disease and stroke numbers were decreasing at the hospitals, and people were waiting because they were afraid to go. So we made a big push to make sure that people still felt really comfortable doing that. And then we also put $2.5 million of research funding towards COVID, because there are so many huge effects on heart patients, and then also the effects on the heart after you've suffered from COVID.
Wow, that's a lot. Taking 5,000 people virtually for a walk is very impressive, and such an interesting spin. It seems natural, but hearing you say it's great that you were able to switch and think about how COVID was going to affect your survivors. I mean, it's so interesting. So what have you taken from this experience? What will you continue to do differently, or the changes that have been put in place? What does that look like for you moving into the new normal?
So we have found that we are just as effective at home, and that we can engage with our volunteers through virtual settings, which we hadn't really tried in the past. So that's something we will take forward. We also started dipping our toes into more community needs. We have been doing that for a couple of years, but we've really put a focus on looking at the needs of our community before they get to the point of prevention. So access to healthy food and access to primary care. And so we've really ramped up our efforts around that. So we have a farmers market that's starting on Friday that we will continue on down the road. And so I think just being more community focused, this has given us an opportunity to look at what our community needs and dive into that.
Great. Yes, we're all in this together, and we all need that support. So that's wonderful to hear. It sounds like you've had a lot of success, but share one specific story that can be an inspiration to us all.
Yeah, well, our board of directors really dove in to ensure that we had a successful year. And so we have a national criteria for our board of directors for the Heart Association. And our board was one of 3 in our region to get a gold standard board criteria. And it's a very difficult and highly regarded, so I'm really proud of them. And then also, I think the work that we've been doing with getting out of our silo and working with other nonprofits and the city officials to get our farmers market up and running is a huge success. And so that farmers market will be at 850 Lady Walker Boulevard. They will double SNAP benefits. So if you have SNAP, you have $1 to spend, you get $2 to spend there. And so that's a sustainable program that we've set up during COVID, and I'm really proud of it.
You certainly do have a lot to be proud of, and having good people backing you, behind you, like you have with your board, is so critical to delivering the mission. So keep up the good work, and thanks for joining us today.
Thank you, Blair.